Cardiovascular diseases such as stroke and heart attacks are the leading cause of death globally. Hypertension is the leading risk factor for cardiovascular diseases. According to the National Stepwise Survey by Ministry of Health, Uganda is one of the countries with high burden of undiagnosed and uncontrolled hypertension in the region. Dr. Geoffrey Musinguzi, a research fellow at the School of Public Health, has researched about hypertension for close to 8 years. He highlights some of the issues surrounding the condition.
Hypertension is largely asymptomatic. What happens is that many people may be hypertensive, but when they're actually not aware, when they're actually moving, so sometimes until they get a knockdown, maybe a stroke or a heart failure or a heart attack, that's when they actually discover they're hypertensive, but when actually they have reached what? Hospital. So
eating a healthier diet with less salt, exercising regularly and taking medication can help lower blood pressure. The researcher says that hypertension care and treatment is partly affected by COVID-19.
Some patients are becoming increasingly uncomfortable to undergo through this complete screening because for fear, for example, if I'm using a BP machine to measure high blood pressure and you're using it on multiple patients, so some of them have complained, they have expressed some bit of anxieties doing that.
Most of the cardiovascular diseases can be prevented by addressing behavioral risk factors such as tobacco use and the use of alcohol, among others.
Smoking is one of the biggest challenges regarding because it affects almost every part of the organ of the body and it's a high non-risk factor for hypertension. So if somebody is hypertensive, for example, and smoking, their risk is even higher of getting maybe cardiovascular endpoint. But if they actually stop smoking or if they cease smoking, then they actually reduce their risk of becoming hypertensive.
Even though the prevalence of hypertension is high, 150 million people in sub-Saharan Africa are expected to have hypertension by 2025. Awareness and treatment rates have remained low.
The global burden of hypertension is high. Actually about, we could say about 1.4 billion people are hypertensive globally. And then the other biggest challenge is that the majority of those actually occur in low and middle income countries, including, like, for example, Uganda. Unfortunately, low and middle income countries are not always prepared. They don't have the capacity, they don't have the competence to deal with this huge burden.
Ministry of Health signed a memorandum of understanding with Healthy Hearts Africa to strengthen the provision of services for managing and preventing hypertension. Healthy Hearts Africa supports local health systems by increasing awareness of symptoms and risks of hypertension by offering education, screening, treatment and control. The program is currently active in both East and West Africa. Zahara Bigaba, UBC.